Hello everyone. In this video, we will talk about hyperthyroidism. Now, hyperthyroidism is increased circulating levels of thyroid hormones. So, when this will happen, when thyroid hormones are increased, it will lead to multiple clinical features since the thyroid hormone affects almost every system in the body. So, all the clinical features that happen due to increased circulating thyroid hormone levels is called hyperthyroidism. Let us look at all the causes of hyperthyroidism and all the conditions that lead to increased circulating thyroid hormone levels. The first one is Graves' disease. Then you have multinodular goiter, thyroid adenoma, decurvain's thyroiditis, postpartum thyroiditis. Then it may also happen because of drugs like amiodarone. There might be factitious thyroid hormone production, which means that there will be an excess thyroid hormone produced not from the gland itself but from extra thyroid tissue present anywhere else in the body. Then we can also have struma ovari, which is a tumor causing increased thyroid hormone secretion, and this tumor is located in the ovary. An adenoma present in the pituitary, which secretes excess TSH, can also lead to an increase in the amount of thyroid hormones because TSH stimulates the production of the thyroid hormones. Another tumor which is responsible for increased thyroid hormone levels is hydatidiform mole. So we will see thyrotoxicosis or hyperthyroidism in hydatidiform mole as well. Next, thyroid carcinoma can also lead to increased production of thyroid hormones. Now let us look at what clinical features are seen with increased circulating thyroid hormone levels. So if we look from a metabolic point of view, the person will have an increased appetite, but despite this, there will be weight loss, excessive weight loss. And then the person will also have heat intolerance. In autonomic features, the person will have sweating and tremors. In the cardiovascular system, the patient will experience palpitations. If we look at neurological symptoms, the patient will complain of fatigue, irritability, emotional lability, and anxiety. In the gastrointestinal system, there will be complaints of diarrhea. In the eye, there will be diplopia. There will be muscle weakness. And in the genitourinary tract, both the males and females will experience infertility, and the females will have amenorrhea or oligomenorrhea. So remember, there is an inverse relation. In hyperthyroidism, the menstrual cycle reduces. There is amenorrhea or oligomenorrhea, which is seen in females. If we look at the signs that we observe as a clinician, there might be a goitrous enlargement of the thyroid gland. So the gland might appear enlarged, but it's not necessary that it will be present. Then the patient will have weight loss, tremors will be seen. In the palpitations, if we take an ECG, what we will see is either a sinus tachycardia or atrial fibrillation might be present. In the eyelid, there will be retraction or lag of the eyelid. Heart failure may be present, myopathy is present, and there are exaggerated reflexes in the muscles. If we talk about the investigations to be done, the first investigation obviously has to be the circulating thyroid hormone levels. So we do a serum T3, T4, and TSH to see whether these hormones are increased or not. Now, based on the levels of these hormones, we have different conditions and different causes. So, if the T3 and T4 are raised and the TSH is reduced, which will happen because the T3 and T4 will have a feedback effect on TSH, which will reduce the amount of TSH, then the causes are primary thyrotoxicosis, which is caused by either thyroiditis of the gland or Graves' disease, which is the autoimmune condition, or it might be drug induced. But if thyroid hormones are raised and TSH is also raised, then it indicates that there might be a TSH secreting adenoma in the pituitary, which is causing the hyperthyroidism. The other investigations that we can do are TSH receptor antibodies for Graves' disease, because Graves' disease is an autoimmune condition where the TSH receptor antibodies are targeted. We can check the presence of these antibodies in the blood. And then we can also do a radio iodine uptake scan, where we check how much radio iodine is taken up by the thyroid gland and what kind of a pattern we have observed. Then we will also do an ECG to rule out arrhythmias. Now let us look at the protocol of investigations that we have to do. The first step will always be to check the amount of thyroid hormones. So if TSH is low or T3 T4 is high, then the next step would be to do a thyroid scintigraphy or a radio iodine uptake scan. And based on what kind of a scan we have obtained, we can classify the diagnosis. So if we see in the first image, there are multiple areas of increased uptake of iodine, which is like these black areas which you can see. So there are multiple areas of increased uptake, and this indicates that the patient has a toxic multinodular goiter. Multinodular goiter means that there are these multiple nodules which are producing increased amount of thyroid hormones, and because they are producing an increased amount of thyroid hormones, they will require more iodine, and that is why they are appearing blacker than the rest of the gland. So these are toxic multinodular goiter. In the second one, there is a single toxic adenoma, which is causing the increased thyroid hormone levels, and it is taking up more iodine. In Graves' disease, there will be a uniformly increased uptake of iodine by the entire gland because the entire gland is affected. In the management, we can either give the patient antithyroid drugs like propylthiouracil, carbimazole, and methimazole. We can also give radioactive iodine. So the way this works is that increased amount of iodine will inhibit the gland from taking up more iodine, which is ha- called Wolff-Chaikov's effect. Surgery is also a choice in case of goitrous enlargements or in case of a tumor. And beta blockers like propranolol are given for short term management of symptoms like anxiety or tremors or palpitations.